The measles outbreak that started last month at Disneyland is not slowing down. It's now up to at least 114 cases in 14 states. A growing number of doctors are now refusing to treat patients who are not vaccinated. And as Carter Evans reports, it is a policy that puts them at odds with some leaders in the medical community.
Where's your belly button?
Dr. Margaret Van Blurk is a pediatrician in Orange County, California, home to 27 confirmed cases of measles and one of the largest groups of unvaccinated children in the state.
It's just frustrating that, they just don't listen because they come to us to take care of their children, and yet they don't trust us.
Now her practice is on the verge of dropping patients whose parents refuse to immunize.
We probably will just not be able to see them here anymore. I don't want people bringing their children in here and being fearful they're going to get exposed to kids that are not vaccinated.
I feel their pain, but that won't stop the epidemic if you exclude children.
Dr. Kenneth Bromberg is with the American Academy of Pediatrics.
We want to work with families, and there are other ways to protect children other than excluding those families.
He says pediatricians could create separate office hours for children whose parents won't vaccinate to isolate them from other patients.
Whoa, you're even smiling.
But pediatrician Charles Goodman says it's not that simple.
What would happen if a patient infected with measles came into your office?
It would be a disaster. I'd have to call the health department. It would close our office down. Every patient that was in there would have to be basically quarantined for a period of time.
He says babies who are too young to receive the vaccine are especially at risk.
The disease is so contagious that they could give those babies measles and those babies could die.
As a physician, we take the Hippocratic Oath, and it's first to do no harm. And by bringing patients in who are not vaccinated, I think we're harming our other patients who depend on us to keep them healthy.
As the outbreak worsens, some doctors feel the strongest medicine may be a dose of reality.
Okay, we're ready for vaccines.
Carter Evans, CBS News, Los Angeles.